Hi and welcome to Chapter 4, Upper Limb. We will be covering the fingers, which are your digits, the hand, and the wrist out of this chapter. In a couple weeks we will return to Chapter 4 and we will cover the forearm and the elbow. But for now I want you to just concentrate on the three positions, digits, hand, and wrist. So let's go over some anatomy from this chapter and a couple items that you need to be aware of when you're setting up your room prior to the exam. One of the things that you want to do is that requisition that we've been practicing in lab. Make sure you come in, you prepare your room. A lot of things that you can do prior. Take a look at the rec, see what are you taking an exam of. Get your cassette, your tube ready. Make sure you know where your lead shielding is and markers. And then you can have all of that set up and call the patient back. Make sure off the requisition you identify your patient. Make sure the right body part is ordered. Your patient is comfortable. If they're in a wheelchair, you can leave them in the wheelchair. There's no reason to transfer them over to a chair. Your gonadal shielding, you're using half aprons for these, but some rooms do have full aprons that you can use. Again, think about what's comfortable for your patient when you're deciding what to apply to them. Any jewelry that will be in the way, like your rings, or bracelets, you want to make sure that they remove. Every once in a while they come in with a wedding ring that they're not able to take off. What you will want to do is have them use some lotion or some soap and try to remove that, especially if there's a lot of swelling taking place in that hand. If it's something that can't be removed, you can document that you're unable to remove it, and in some instances they will actually cut those rings off in the emergency department before they come back to you. Also go through and explain to your procedure to your patient and tell them what you're going to do, especially with this. If they come in with a broken hand, it's going to be rather difficult for them to move that hand around, so you may have to show them on your hand on the table and tell them, here, I need you to put your hand into this position. Some other things to consider is that with taking a look at the rec, decide, is this a trauma situation or did they really order all three exams? So is it a routine position? If it's trauma, you're required to do two positions, so they may want a PA hand and a lateral hand, but they're not going to do the oblique. If it's routine, you'll do a PA oblique and a lateral for that position. So it really comes down to what happened to that person. If it's trauma, again, don't force them into positions. Do your best to obtain the positions. And then you may have to make a note in the computer system that the patient wasn't able to move. You can set up your exposure factors before doing your positioning. Just make sure your control panel's set up. Generally, anywhere between 50 to 60 is what we're going to use for a kVp range. And then again, depending on the machine, that can vary. You could use anywhere between 1.5 to 5 for your mass. On page 139 in your book, it tells you about cast considerations. When they come in with a cast, if it's a plaster cast, increase that kVp 5 to 7 kVp. If it's a large plaster cast, it's going to require more, up to 10. Most patients will come in with a fiberglass cast, and we bump up our kVp between 3 to 4 kVp, again depending on that machine and how thick that cast is. Now your Carlton Adler will tell you to measure with your calipers and then base your technique off of the measurement for that room in the cast. And so you just go about that and follow your technique charts that are hanging in your room rather than bumping up the kVp that usually will have you bump up mass. Make sure when you're hanging up your images, all of those should be hung up with the fingers up at the top. Make sure you have evidence of collimation. You should always have that pretty picture border, and that all your views are marked with the correct marker. Most places want your marker on the lateral side of the film, but there are a couple institutions that would like the marker on the medial side of the film. So again, that comes down to where you're working. Trauma is a little more difficult than the person that is walkie-talkie. You could deal with some type of trauma situation such as shock. They may be unconscious, and so you're going to do these procedures on a stretcher. All of these can be done exactly the same way as what we're going to go over in lab. It's just sometimes you might have to be a little more creative and build them up on a tissue box in order to obtain a lateral. So you'd shoot a cross-table lateral rather than placing their hand on a lateral. Your role, make sure you get that accurate history, your room set up. Make sure you've asked if the patient could be pregnant. Make sure you're using eye contact. When you're moving the extremity, support at both joints, and make sure that you're empathetic with your patient and what they're going through. Don't try to fix your injury. Make sure that you're taking the x-ray as is. So again, rather than fighting with the patient to get them into that position, you may have to do some cross-table laterals. Short exposure times help with reducing patient motion. So sometimes you have to up your MA or up your time and decrease your MA, and that will help with those situations where the patient can't hold still for very long. Speed's really important, especially in the emergency department, so try to be creative and think outside the box when you're trying to come up with some ways to do these films. Let's go through some quick anatomy. Again, we're not going to worry about the humerus or the forearm, but we will talk more about the wrist, the hand region, and those digits. So your hand is divided into three groups. There's the phalanges, the metacarpals, and the carpal bones. Here's a diagram of what that looks like. You have your distal, your middle, and your proximal phalanges. You also have your metacarpals, your carpals, and then you do need to know the distal portion of your forearm for this chapter. You also must know the joints. So here you have your distal interphalangeal joint, sometimes referred to as your DIP, D-I-P. Your proximal interphalangeal joint, which is your PIP or PIP. When we're counting the digits, your thumb is your first digit, second digit's your index finger, middle finger's your third digit, fourth digit's the ring, and fifth digit's your pinky. So on this example that you see, your fifth digit has your fifth metacarpal phalangeal joint, your fifth carpal metacarpal phalangeal joint. So here's an example of what this looks like on the x-ray, and I did go through and have this labeled so that you can actually see where's the fifth dip joint, where is my first proximal interphalangeal joint, those types of things. So make sure you review your joints and that you're comfortable with those. A lot of examples that you can go through and label. These will be very similar to what the test will look like. So you will have a letter and you will need to identify what those components are, both on a written test and the test in lab for evals. So here's an example of what those actual components are. So if you take a look at F and you line that up, you can see that we're looking at the proximal interphalangeal joint on the second digit. And here again is the completion of that alphabet. So try to match up what you looked at on the previous film, and did you get all of those correct? Your wrist, the carpal bones, I would encourage you to try to come up with a saying to remember these by. You have your trapezium, your trapezoid. Capitate is going to be the largest bone in the wrist, followed by the hamate, which has the hook. The distal portion is that top row, and then you have your proximal portion, which is closer to the elbow. You have your scaphoid, which is sometimes referred to as your navicular. You have your lunate, triquetrum, and pisiform, which is the pea-sized bone. So some sayings or mnemonics that they have for the bones. Send a letter to Peter to tell him to come home. Sometimes you'll see the saying, Steve left the party to take Carol home. I would encourage you to come up with your own saying or use one of these to help you remember those carpal bones and their locations. So you would get something that looks like this. Down here at the bottom you would start with Steve left the party, and then you return back over to the trapezium to take Carol home, and home ending up at hamate. Here's what those bones look like on an x-ray. So again, if you remember your saying, Steve is your scaphoid bone, and then you can work your way around the proximal end to the distal end, where Carol would be your capitate, or G. So again, here's the final outcome with everything being labeled. Thank you.